Hi, everyone. My name is Dr. Ann Auburn, owner and founder of the Natural Health Improvement Center in Grandville, Michigan. Tonight, I'm going to be talking about the seven dwarfs of hormone deficiency. And I don't just mean women, I mean men as well. You'll see when we get into the talk. So, as you might have guessed from the title, the seven dwarfs of menopause and andropause mean that sometimes the mood can be a little bit unhappy, cranky, etc. Your skin can feel itchy, dry. You can be sweaty, sleepy, bloated, forgetful, and sometimes a little bit psycho. So let's see what causes this. So I want to clear something up first, which has to do with the Women's Health Initiative study. The trial of Prempro, which was synthetic estrogen and progestin, versus placebo, was stopped because of the invasive breast cancer statistic exceeding the boundary for acceptable adverse effect. But there's a lot more to that than what meets the eye. Let's look at what you didn't hear, because this was analyzed after the study was done, and it really doesn't tell you the whole truth. The study, what you didn't hear, overall out of 10,000 most postmenopausal women per year, it showed the following health risks with these synthetic hormones compared to placebo. 7 in 10,000 women had heart attacks, 8 in 10,000 women had strokes, 8 in 10,000 women had pulmonary emboli, that's blood clots in the lungs, and 8 in 10,000 women had invasive breast cancers. But this is what they didn't tell you, and what was really gone over again and again by many scientists who were trying to shout out the truth within the year after the study's completion, that these are extremely tiny risks, no more risk than what you would have without hormone replacement therapy. And the other point here is that none of this occurred in the Premarin synthetic estrogen only group. It only occurred in the groups that had the progestins. And you'll learn a little bit later how much I dislike progestins or synthetic progesterone, which is nothing like the progesterone that you have in your body. So the hormone replacement and cancer question, the media news articles about hormone replacement and adverse effects, breast cancer, stroke, heart attacks, etc., are referring only to oral synthetic hormones, specifically Prem-Pro, containing progestins, as noted earlier. The truth of the matter is that 90% of postmenopausal women who develop breast cancer have never taken any kind of HRT, or hormone replacement therapy. So it is a fact that hormones are very, very safe. There's nothing that says that they actually cause cancer. Even in women who have had family members that have had breast cancer, unless every woman in their family, all the aunts, the grandmother, all the sisters, etc., have had breast cancer, then you have to worry about things like the BRCA gene, BRCA. And there are some other genes that, make one more susceptible to hormone-mediated cancers. But this is actually quite rare. And if you are worried about this, there are tests at our office that look at your genetics and tell you if you possibly fall in one of these risk categories. Also, I might mention that there are some studies that show that people that carry the BRCA gene actually have some protection when they are on hormones, especially the estriol hormone, the weakest estrogen, and progesterone, that's natural progesterone, which I'll tell you about later. So the leading cause of death for postmenopausal women is really heart disease, not breast cancer. 46,000 women die each year from breast cancer, but about 400,000 women die from heart disease yearly. Now, these numbers are from a few years ago, so those may have gone up. I haven't checked them recently. But nonetheless, many more women die from heart disease than breast cancer. Also, pneumonia and influenza actually outrank breast cancer as leading causes of death. Also, 1.5 million women will suffer complications of osteoporosis. Several hundred thousand will actually die from it, from the complications after being in the hospital, being bedridden, getting some kind of infection or pneumonia. So, hormones do help maintain bone and build bone. And I've seen this over and over again on bone densities, and it may prevent a hip fracture or some sort of fracture when you fall. So the conclusion for HRT and cancer in my book is that the risk of developing breast cancer from hormone replacement is less than the risk from postmenopausal obesity and alcohol abuse and all of the other diseases I mentioned already. Hormones are quite safe. The way we do them is very safe, as you'll see more about that in a minute. And the risk is no more than if you didn't take hormones at all. But the risks that you will have without taking hormones are much greater. We'll show you those in a minute. So let's look at cardiovascular disease. Research shows that estradiol, both bioidentical and synthetic, have a powerful and positive effect on cardiovascular health and prevent heart attacks and strokes. Now, some of the ways that this does this is that it increases your good HDL cholesterol and it decreases bad LDL cholesterol. And I've seen this several times in my patients. It also helps dilate arteries by relaxing the muscles in the blood vessel walls, and it increases blood flow to the heart and the vital organs, and it often reduces higher blood pressures. And I've seen this over and over again too. Although you won't really see it lower blood pressure in people who already have normal blood pressure. It's very interesting. Estrogens also act as antioxidants and inhibit oxidation of LDL cholesterol and thus decrease plaque buildup in the arteries. So now testosterone and cardiovascular disease. Let's talk about the men now. And also this would affect women because we do look at testosterone for women as well. Studies show that low testosterone in men is related to higher incidence of heart disease. Testosterone has been shown to improve the dilation of blood vessels and improve blood flow to all organs. There are no studies that prove any relationship between testosterone levels and the creation of prostate cancer. In fact, it has been tried to actually remove testosterone from males to prevent, not just because, they've gotten prostate cancer, but to prevent prostate cancer, and it actually makes no difference. It's also a known fact that any person with a chronic disease does better with testosterone. It's often the case that these chronic illnesses and their various problems, whether that be chronic pain or fibromyalgia or rheumatoid arthritis or psoriatic arthritis or some other chronic disease, these cases all have low testosterone, and they feel better when you put them on it. So for cancer protection, there's many things that we can do. For women especially, we can give them DIM or I3C. These are both slight variants upon each other, which are extracts of cruciferous vegetables. To get the same amount that you would get in a couple of these pills per day, you'd have to eat 8 pounds of broccoli. I don't think anybody's going to do that. Also, there's calcium deglucarate. That's in our product Estro Focus. That contains DIM, the extract of the cruciferous vegetables, plus it contains calcium deglucarate. Calcium deglucarate is something that your liver always makes, and it creates the process or the possibility for the process of glucuronidation, which is one of the phase 2 liver detox items that binds toxins. So it also will take out xenoestrogens and xenochemicals that act like other biologic chemicals in the body and cause a lot of havoc in the body. These come from plastics, other chemicals in the environment, herbicides, pesticides, and other things that are similar in chemical nature. Also, when we are looking at cancer protection, we want to measure your estrogen metabolism. What that means is there's several estrogen metabolites we can measure. Some tests only measure 2 of these, 2-hydroxyestrone and 16-hydroxyestrone, and they make a ratio out of them, making sure you have enough of the good 2 estrogens that push you down a metabolic pathway away from cancer. And then there's urine tests that look at 2-hydroxyestrone, 4-hydroxyestrone, and 16-hydroxyestrone. Of course, with the 16s and 4s being the relatively bad estrogen metabolites, which can push you down a pathway closer to cancer. Now, none of these mean that you're going to get cancer or you're not going to get cancer, but these are things that we can manage easily with supplements to help the body metabolize estrogens better. In men, we measure PSA and estradiol and avoid excessive testosterone levels. Also, there's lifestyle, diet, exercise, quitting smoking, quitting chemical things in and around your body and your environment, and detoxing regularly. And then there's vitamins B6, methyl B12, and methylfolate that help your natural methylation detox. And just your plain old multivitamin, multimineral is a wealth of cofactors that help you to detox better on a daily basis. You're not just making expensive urine when you take a good multivitamin, you're actually helping your body function better in a very toxic environment. Purified omega-3 fish oils, those also have many benefits in making everything in your body work better by making your cell membranes more permeable and flexible. And then there's lycopene, CoQ10, melatonin, and I could name off many other anti-cancer things, including green tea and rosemary and other things that are helpful in that realm. But we won't get into that right now. But these are some of the basics, things that we can do for our patients who are taking hormones if they're interested in looking at that. Now, there's another interesting fact about natural hormones. Think about this for a second. For 9 months of pregnancy, the body produces 4 times the normal levels of stronger estrogens, estrone and estradiol. We know that full-term pregnancy is associated with a much lower incidence of breast cancer. Why is this? Well, the increase in aggressive estrogens is overshadowed by an even more significant increase in the protective estriol and progesterone. And we'll talk more about that later. Bioidentical hormone replacement facts. Estrogen levels achieved with bioidentical HRT are lower than the levels seen in ovulating and menstruating women. In other words, we're not trying to get your hormone levels what they were in your 20s, and that's both for men and women. What we're trying to do is get those levels to where you feel good, where they're in the lower 25th percentile of the normal luteal phase levels for especially estrogen and progesterone. Now, testosterone and DHEA are a little bit different. We're trying to get those into the middle of the ranges if we can. And we don't go just by the ranges that are on the labs. We have specific ranges that we're shooting for anti-aging and for all the benefits that we're looking at. And also note that estrogen replacement can lower your risk of Alzheimer's by 60 to 75%. That was shown in both American and French studies. And actually, the bioidentical hormones worked even better than the natural hormones. And there's evidence for testosterone showing the same. And as I mentioned earlier, estradiol dramatically decreases the risk of osteoporosis, which is not a minor thing. And you really have to have a bone density to really see if you have osteopenia or osteoporosis. And there are a few other tests like the CTX blood test that we can do, but the most accurate and the gold standard is a bone density. So again, menopausal hormone therapy and long-term all-cause and cause-specific mortality from the Women's Health Initiative randomized trials gave us more information after the study was completed. Now, these were studies that were done with the women who participated in the trial. After the trial was basically completed, they did some other spin-off studies. And the question here was, what is the relationship between use of menopausal hormone therapy versus placebo for 5 to 7 years and the mortality over 18 years of follow-up? And there's the reference there if you do actually want to look the study up. So the studies show that hormones do not increase the risk of heart disease or cancer. These were the conclusions. Among postmenopausal women, estrogen plus progesterone hormone therapy, and these were both synthetic forms, for a median of 5.6 years, or just synthetic estrogen alone for a median of 7.2 years, was not associated with risk of all-cause cardiovascular or cancer mortality during a cumulative follow-up of 18 years. And this study was repeated 3 times with the same exact findings. Now, that's the gold standard in medicine. If you can repeat something at least once and get the same results, then it's deemed to be true. So these are the facts that I go by. I don't go by the initial WHI media announced information from the Women's Health Initiative study. This is quoted all the time by many doctors, but there is an awakening in the medical field for a better understanding of this, and the fact that there are many, many benefits for hormones, and the risk is no more than if you'd not taken any hormones at all. So the bottom line, in my opinion, is that with all the data presented here and many, many other resources, plus what I've seen as a practicing physician, the risk of using hormones poses a much higher health risk than the risk of not using hormones at all, or not looking at using some hormones. It really comes down to a quality of life decision between the patient and the physician. And if you do think that you're more at risk, as I said earlier, we can do genetic testing to see if you have the genetics that make you more predisposed. And then you can make your decision with data and not just out of fear. So let's continue on. For men, in the cancer question, hormones will not cause prostate cancer. If you have prostate cancer already, both DHEA and testosterone need to be avoided until that cancer is handled, and hormone levels should be monitored as well as the PSA, the prostate-specific antigen, and testosterone decreases the risks of other lethal diseases like diabetes and osteoporosis and many, many more things. It's cardioprotective as well. Many benefits of taking testosterone. So let's look at natural versus synthetic. What's the difference between bioidentical natural hormones and chemical or synthetic hormones? So let's look at synthetic Premarin and Prempro. These are a mix of horse urine-based chemicalized synthetic estrogens, equilin, equilinin, etc., plus additives and coatings which are also synthetic. They can remain in the body for 5 to 13 weeks. Potency of synthetic estrogen is about 200 times that of natural estrogen. It contains a higher percentage of the more aggressive types of estrogen, and it's pretty much a one-size-fits-all dosing. There's a few different variations, but they come in strict, pre-made combinations, and you get what you get. So there's not much individual variation here, and you're getting something that's very strong and a bit foreign to the body. Now, natural bioidentical HRT is bioidentical. It replaces instead of substitutes with an unfamiliar similar chemical. It's eliminated from the body in a matter of hours, not weeks. Potency is usually less than estrogen levels in ovulating women. In fact, that's what we're going for. We're trying to do, really less than you were in your mid-20s. And like I said earlier, we're shooting for the luteal phase numbers and in the lower 25% of that range for estrogen and progesterone. And then we have other things we're aiming for. We tell you all about this when you come in to see us as a patient. We teach you what the levels are that are ideal for anti-aging. So other hormones are tested and treated if necessary to keep natural balance intact. So we check DHEA, cortisol if needed, testosterone, progesterone, thyroid hormones, cortisol, insulin, etc. And there are exceptions to these rules. Not everybody gets all of these things tested, but if we see the need for them and we're trying to make the person better and they're having specific issues, we do end up checking them, and it really does help. Diet makes a difference too. So we do talk to people about diet, nutrition, exercise, stress control, digestive function, and ask them to detox regularly. And those are very simple things at our office. We have simple protocols that you can do easily. And each individual gets a customized treatment program. No program is exactly the same as anybody else's. Occasionally, you'll get somebody who just can't tolerate a certain hormone. They don't like it, they don't like how they feel on it, and so we have to change their program to work without that particular hormone or do very little of it. Not the ideal that we would like, but we balance it out for them so it works for them and their body. So it's very individualized. So natural, females make beta estradiol. A common synthetic estrogen replacement consists of alpha estradiol. That's the really strong estrogen. Not only is the message content changed, but alpha estradiol is 30 times more powerful than the naturally occurring beta estradiol made in humans. So why did they give alpha estradiol from horse urine? Well, the intentions were good to start with. They wanted, the women to feel better. So horse estrogen does relieve hot flashes and night sweats. But later, pharmaceutical companies figured out how to synthesize these estrogens from plants, but naturally occurring substances cannot be patented. So they had to be altered slightly to make them a unique molecule to be patented. And to make a significant profit and corner the market, companies patent their products so no one else can sell it. So this is, how it works in the traditional pharmaceutical world. And, pharmaceuticals can sometimes give us many, many benefits. But in this case, we usually have a better way with natural and bioidentical hormones. Now, there are currently some natural bioidentical estradiol patches that are available, and those do work quite well for a lot of people because they give a nice smooth delivery. And that is commercially made and often paid for by insurance. But they don't contain the helpful estriol, the weakest estrogen, and those will need to be given separately and made from a compounding pharmacy. Now, I just wanted to note here on this picture that this is the female hormone cycle. It shows that you have FSH and LH that surge mid-cycle, giving ovulation, and your estrogen will go up and peak, and then you get a second lower estrogen peak. That's during your luteal phase, and then progesterone doesn't really start going up till about time of ovulation, and then it peaks out during luteal phase. So suffice it to say that there is a very delicate balance and rhythm for female hormones. Now, this isn't happening when you're in menopause, but we do deal with quite a few young women who are still cycling, or women that have polycystic ovarian syndrome or some other form of estrogen dominance. So we do want to look at this rhythm, and we are, in the menopausal women, trying to get them their progesterone and their estrogen to the lower 25% of the luteal phase ranges. Now, male bodies and hormones. The males, they maintain a fairly steady production of testosterone all month. There's really no cyclic variation like in the female. Variations in production do occur with stress, chemical and toxin exposure, as well as aging. And what I've seen a lot of times is if a person has chronic pain, their testosterone levels will be much lower. Like women, thyroid and adrenal function can affect overall hormone balance, so we do check those in men too. And one thing that gets skipped a lot in guys is a bone density. Men do have bone density that goes down as they age as well. And so this is something that we think about when men are over 50, or when we see that they're a little hunched over or they're on the thinner side especially. We do want to check their bone densities. And this isn't thought of very much in medical circles, but we do look at that at the Natural Health Improvement Center. So on the estrogens, I want to just go into the different hormones and talk a little bit about what they do. Estrogens, there's 3 types. There's the strongest, estrone, we also call it E1. Estradiol, we call that E2. And estriol, the weakest estrogen, which makes up most of your estrogen actually, also called E3. So the E1 or estrone, this is primarily made in the postmenopausal women from fat cells, but it's always there. And it's also made from testosterone derivatives. It's associated with overweight women and estrogen-dominant women. And it's highly aggressive estrogen. It is associated with breast cancer if it's very given in very high levels, and if a person's over-treated for a long time. So we want to get some degree of balance. We don't want to over-treat people with hormones at all. And it's fast-acting. It works well for hot flashes and night sweats. And we do have a few people taking this in a formula called Triest. Normally, it's 10 to 20% of female estrogen. It makes up the estrone is 10 to 20% of all their estrogens. So if we do give it, we generally don't give more than 10%, but it's pretty rare that we actually have to use this. The Premarin synthetic formula contains about 75 to 80% estrone-like hormones, and other synthetic hormones are 100% estradiol. Now, estradiol, it's very active. It's very good for getting rid of hot flashes and night sweats, usually, if you get the right amount. It's made in the ovaries, adrenals, fat cells. Almost every cell in the body has receptors for estradiol. It protects bones. It maintains bone density. It helps vascular structures. It helps cognition. It reduces dementia. It's associated with uterine cancer if you do overdose somebody for a long period of time. This is what we're very careful about at our clinic. This is why we monitor and maintain adequate but not excess levels and balance it with the other hormones as best as we can and give you cancer protection and talk to you about those kinds of things, especially if it seems like you might be more at risk. Now, estriol, this is the least active, weakest hormone of all the estrogens. It protects and nourishes hair, skin, mucosal membranes. It's great for vaginal dryness and discomfort that happens in that area when it gets real dry. It does not have much cardiovascular or bone protection activity. Human females make about 60 to 80% of their estrogen as estriol. Premarin and Prempro only have 6 to 15% estriol-like estrogen. Most other synthetics have none, and most of our formulas have at least 50%, if not 80%, when we get these compounded. And if we give them separately, they're easy to administer, even if you are doing the commercially made patches. So estriol, I want to say a little bit more about its anti-cancer features. Many articles have been published on the beneficial anti-cancer effects of estriol. 1977 in JAMA, 1973 in Cancer Research, and 1980 in The Lancet. But no real large-scale follow-up studies have been undertaken because there's no sponsorship, because no pharmaceutical company can make money from a natural estrogen. So it's really hard to study these types of things because to get very large numbers, you would have to have a lot of money behind that to study it, and it's just not there because it's natural. Natural effects of estrogens, these will prevent bone resorption and osteoclast activity. So osteoclasts basically break down bone. It stimulates lipoprotein lipase, therefore it breaks down fat. So many people feel it will decrease their cholesterol levels. Often we see the HDLs go up and LDLs go down, as we mentioned earlier. Also, it tends to lower insulin levels. Now, I can't really say that it's like your answer to weight loss, although we have had some people improve their weight when they get their estrogen balanced. I think it's more of a combination effect of sleeping better, feeling better, having less hot flashes, having a better mood, and then you're better able to stick to a good, healthy dietary regimen and exercise schedule so that you can lose weight. That's what really works best. It does induce relaxation of blood vessels, helping that blood pressure, and lubrication and development of vagina, vulva, and cervix, and also preventing urinary incontinence and recurrent infections in the vaginal area and the bladder area by keeping all those membranes moist. Now, natural effects of estrogen premenopausally will prepare the uterus for pregnancy, breast tissue development for milk production, causes the egg to mature for ovulation, promotes growth of the fetus, lubrication and development of all those structures we mentioned earlier, promotes pubic hair growth and nipple pigmentation, stimulates body fat to help the fetus grow. So at different points in your life, you're going to have different effects from these estrogens. Now, signs of estrogen deficiency, of course, everybody knows about hot flashes and night sweats, but sleep disturbance. Now, some of that is the night sweats, but some of it is just not being able to fully rest. Um, maybe having moodiness or just feeling uncomfortable, maybe having more aches and pains. I've seen a lot of those go away, when people take hormone replacement, fatigue, depression, moodiness, anxiety, dry skin and eyes. A lot of the mucous membranes, not just the vaginal ones, but other mucous membranes dry out when you don't have enough estrogen. Um, and the aches and pains in the joints, as mentioned earlier, and muscles. Also, headaches. Some people get headaches if they get too much estrogen too fast, but most headaches, if they're hormone related or when the hormones drop, or when they are absent, but it can go the other way too. And also mental fogginess and forgetfulness. And effects of excess estrogen could be water retention, bloating, salt retention, increased body fat, interference with normal insulin release and blood sugar control. It can increase cravings, overgrowth of the endometrium, that's the lining of the uterus, and sometimes frequent heavy periods. Very rarely we do in postmenopausal women get some bleeding. This requires us to do an ultrasound and check that tissue, just make sure that it's nothing wrong with it. But occasionally it does happen. It doesn't happen that often, but it does occur. Overgrowth of breast tissue, breast tenderness, and fibrocystic changes. Now, this again does not mean that you have cancer. In fact, when there is cancer, it's actually not painful. If you have soreness in your breast, it usually means that it's just fibrocystic changes. Anxiety, irritability, migraines, gallbladder disease due to liver stress. Now, that I think is really referring to more oral estrogens, which we do not do. I never give oral estrogen or testosterone. And the same with blood clots and reduced vascular tone. This is, when people are taking oral estrogen, this does not happen. Blood clots do not occur when you're doing topical estrogen, either in a patch or a cream or a gel or something like that. And that's the majority of what we do. Natural effects of progesterone. This stimulates osteoblast bone building activity. So this is the hormone that really builds bone. I always tell people, if you're going to take one hormone, take progesterone. It's an excellent hormone and it does a lot. We call it the happy hormone. People are calmer, they sleep better, et cetera, et cetera. A lot of that is best done in the form where you actually put it in a capsule and swallow it. But you can get some of these same effects definitely when you do it topically as well. It's a natural diuretic, helps get rid of fluid. It helps use fat for energy at the cellular level. It's a natural antidepressant. Some clinics that center around treating people with hormones for psychiatric problems, they are giving doses of anywhere from 200 to 600 milligrams a day of progesterone. It can be very powerful. It restores regular sleep patterns in most people. It's a precursor of making your own cortisol or corticosteroids. So it helps you with that fight or flight and the recovery from that whenever you are under stress. It also keeps insulin release in check. It prevents overgrowth of the endometrium, that's the lining of the uterus. So you can see how it balances out the estrogen. And it prevents breast tissue overgrowth. It maintains sex drive. Also, that is also affected by all of the other hormones. And a lot of people think that testosterone and DHEA do more of that, but it's very individualized. I think all the hormones have a role in that. It maintains normal blood clotting parameters, and it protects against fibrocystic breast changes, and it prepares the uterus for implantation of a fertilized egg if you are of childbearing age. All right, so again, natural progesterone is another anti-cancer hormone. In 1981, in the issue of American Journal of Epidemiology, Johns Hopkins research, 1,000 women in perimenopause were followed for 13 years. And their conclusions were that progesterone exerts a strong protective effect against cancer. The normal level progesterone group had a 5-fold lower risk of developing breast cancer, and a tenfold lower risk of dying from any type of cancer compared to females with progesterone below the normal range. Now, signs of progesterone deficiency, this is going to look very similar to the estrogen excess symptoms: heavy and frequent periods, irregular periods, PMS, fibrous and cystic breasts, endometriosis, uterine fibroids, anxiety, irritability, water retention, amenorrhea, just not ovulating and not having any periods regularly if you're of childbearing age, and oligomenorrhea or infrequent periods. All of those can be signs of progesterone deficiency. Now, excess progesterone, I haven't seen a lot of these, but you could get irregular bleeding in menstrual cycles. You could get hyperpigmentation of the skin when exposed to light. Really haven't seen that one. Fatigue or feeling of sedation. Now, you'd probably have to take a lot of this, and that's why we give the oral progesterone at night, because it does turn into a GABA-like metabolite. And for several hours, it will help you get into your deep sleep. It's pretty much all metabolized by the time you wake up in the morning, but very rarely I will have people that say they're tired during the day with it, so we just lower their dose. If you had really high doses, and again, I've never seen this, even at doses of 400 milligrams a day, you could get nausea and gastrointestinal discomfort. But again, I really haven't seen it happen even at higher doses. Also, bloating can happen when it's taken at high doses, and acne. And I think the acne is because some of that progesterone will turn into testosterone. All right, well, male hormones, testosterone and DHEA, are the androgen hormones, and these are needed in both men and women for fat burning, muscle maintenance, healthy ligaments, tendons, and other connective tissues like hair, nails, spinal discs. Also, it helps energy, mental focus, and libido, and there is cardioprotective and brain protective effects as well. Natural effects of testosterone include muscle strength and endurance, supporting strong libido. Everybody thinks, testosterone equals libido, but like I said, all the other hormones seem to play a role as well. And libido is actually very complicated. It's very psychological as well. Your libido is going to be low if you're stressed or you're having tensions in a relationship, things like that, or problems at work or whatever. So those have to be taken into consideration. Also, natural effects of testosterone include energy and a sense of well-being, body hair production, in men, enlargement of the penis, in other words, erectile function, testes and the clitoris also can be a little bit larger when you are taking it, but again, this doesn't seem to cause any of those cancers. They're just more functioning. It also improves bone density. It improves blood sugar metabolism and insulin sensitivity. Lean body mass and lean body fat maintenance is a little bit easier. Elevation of nitric oxide. Now, this is a naturally occurring substance that helps to keep blood vessels dilated, so improves blood pressure. So there's an additional hormone in addition to estrogen that helps blood pressure, and it improves also balance and hand-eye coordination. Signs of testosterone deficiency include decreased energy and stamina, muscle atrophy or loss of muscle mass, flabbiness and muscle weakness, just not being able to, pick up as much at one time as you did before. Also decreased sex drive, men and women, and erectile function for men, boredom, disinterest, decreased self-esteem, lack of motivation. Your get up and go is got up and gone. Osteoporosis, that bone density, here it goes once again. So you can see how testosterone is important for men, and decreasing axillary, pubic, and body hair. So those are some of the things you might see with testosterone deficiency. DHEA. Now, DHEA is your precursor to both estrogen and testosterone, but it also, because it's secreted in the adrenal glands, it helps the adrenal glands function better. And it can be adrenal supportive if you have adrenal fatigue. I have a whole nother lecture on that if you want to take a listen. Circulating levels in women are 20 times higher than any other hormone in the body, and it declines with age starting in the mid-30s in women. So this is one of the first hormones to start going down. So make sure if you're going to have your hormones checked, you have them check DHEA sulfate, and that is the one that we check, and it should be in women between 100 and 200 at least, and it can be all the way up to 430. Now, some people are really sensitive to this and they might get blemishes or oily skin or something like that with it. And if they do, you can just back off on the dose. And the dose really, really varies from person to person. You just have to check the labs, give them some, and see how they do with it, and check the labs again. Animal studies in mice have shown that higher DHEA levels are associated with increased longevity and prevention of heart disease, cancer, obesity, and diabetes. Human studies with DHEA show improved conditions with concerning autoimmune disease like rheumatoid arthritis, MS, lupus. MS is multiple sclerosis, also osteoporosis and Alzheimer's. The effects appear to be cumulative, so over time, rather than immediate, and diffuse rather than specific, so very broad-reaching effects. Now, while we're talking about DHEA, I just wanted to mention the adrenal saliva cortisol test. If you're having a lot of trouble with sleep or fatigue in the morning, or the 2 o'clock tireds, as I call them, in the afternoon, then we might want to do an adrenal saliva cortisol test. And this test does check your DHEA as well, but it checks your cortisol 4 times throughout the day. So that's why we really don't like to do this test in blood, because it can change very quickly. When you get up, get dressed, get your, self to the lab and things like that. By the time you get up there to the lab to get the blood drawn, the cortisol can be much higher. So the saliva test you can do at home, and then we can see how it fluctuates throughout the day. And this test ranges, depending on the company, from about $100 to $150. Now, DHEA deficiency symptoms include fatigue, altered sleep patterns, decreased sex drive, decreased speed of healing, very similar to the effects of testosterone deficiency, which is another androgen hormone, and DHEA is precursor to that. So natural hormones are supplied in lots of different ways. I mentioned the patches of estrogen earlier. Most of the time we like to do creams and gels. We often also will use sublingual lozenges. At the pharmacy, they call them troches. Sometimes these are very, very good for people, and other times they're absorbed so quickly that the levels will kind of spike. And some people that have a history of fibroids or estrogen dominance, things like that, we don't like to give the troches, because it's more commonly, especially if they do have a uterus, the females, it can make them bleed. But for men, that's not as much of a consideration. And we do usually give the troches, the sublingual lozenges, twice a day to help avoid those problems. We can also do these as pellet implants. Now, the implants will go usually in the buttock area. They go in just underneath the skin in the subcutaneous tissue. The implants usually will last anywhere from 3 to 5 months. I have some people that they last an entire year, which is unusual. And we can do these for both men and women, but generally we don't do them in women with a uterus. It can be done, but a lot of times if you overshoot the amount of hormones, they can bleed for a long, long time if they have a uterus. If people want to come in every 2 to 3 months and get very small amounts of the pellets, we can arrange that, but it's just better in women if they have a uterus not to do hormone implants. There are suppositories that can be taken rectally. We don't usually do those, but we've had a couple patients that requested that. And also sublingual drops. I don't really care for those because they seem to get thicker down at the bottom. So my preferred method is topical gels and creams. All of these are prescriptions. There are some over-the-counter versions that are very low dose that some people like and have come in on those, and they're doing okay on them. When they do these over-the-counter versions, they really are not changing their levels very much. So when we do our testing, you can see that the hormones are still low. But if a person feels good on it and their bone density is good and, they're having no problems, I don't have a problem with them doing them, as long as they're very clean forms without a bunch of additives and, chemicals and things like that. So the way we do hormones at our office is we try to do a brief physical. If it's a female and she's in the age range where she still needs a PAP, we either ask that she gets that from her primary care physician or she can do it at our office. And we like to make sure that their regular labs are doing well too. As mentioned earlier, the hormones can improve your insulin resistance and the use of insulin by the body and therefore your blood sugar. So it's nice to see the blood sugars. It's nice to see the cholesterol lipid profile. And also, if people are fatigued, we often get a thyroid panel or an adrenal function test, as I mentioned earlier. And then sometimes we'll do other specialty tests depending on what their issues are. We listen to our patients intently. We spend at least a half hour with them. New patients get about an hour. And if there are other things to address besides hormones, we try to help them with that because we're holistic. And then we try to make sure that they are getting their regular testing, either mammogram or thermogram, to check the breast tissue annually, and of course all the labs. And if women are of childbearing age, we'll usually get an FSH and maybe an LH, especially if we think that they might have PCOS. That's something that we'd want to check. And sometimes we do an ultrasound of the pelvis and uterus. I don't do these every year on every woman, but there's certain reasons like bleeding or if I think they have polycystic ovarian syndrome. And then, of course, the bone density I mentioned earlier. Just a note on thyroid testing. When we do thyroid testing, we do not just do a TSH. That's sort of the standard, in the medical world. But at our clinic, if we're going to check your thyroid, we're going to check TSH, free T3 and free T4 at least. And then initially we'll check the thyroid antibodies as well. And then if we are having difficulty managing and getting the normal levels that we would like and getting you feeling better, we might do a reverse T3 and maybe even a total T3. But, if there's a goiter or if there's difficulty swallowing or something like that, we might get an ultrasound, or if we feel something on exam or see something. So that's how we look at the thyroid. There's the common symptoms of hypothyroidism are lack of energy, constant tired feeling, can affect the periods, make them heavier, give worsening menstrual cramps, constipation, abnormal sensitivity to cold temperatures or just feeling cold in the extremities all the time, muscle cramps and stiffness, weight gain, drier, brittle skin and hair loss or thinning of hair, hoarseness or a husky voice, slow heart rate, depression. A lot of times people are depressed and nobody bothers to check their thyroid, and it's a very simple thing usually to fix. So this is something we would look at our office. All right, and then hyperthyroidism, we occasionally see this. This is where the thyroid is overactive. You might have heart palpitations or heart racing, heat intolerance, nervousness, anxiety, panic attack, insomnia, breathlessness, increased bowel movements or even diarrhea, light or absent menstrual periods if you're of childbearing age, fatigue, trembling hands. That's pretty much across the board. Every hyperthyroid case I've seen, they definitely have hands that kind of shake a little bit like that, and their heart will almost always be racing at well over 100 beats per minute. And you can kind of look at their eyes, and they have this sort of staring gaze. Sometimes their eyes look like they're popped out a little bit. That's called exophthalmos. That's hyperthyroidism and probably Graves' disease. We often refer these people to an endocrinologist so they can get proper treatment, ultrasounds, whatever they need, correct medications. These people can also get hair loss too, but this is not something we commonly see, but it does happen, and there's your symptoms. Now, I mentioned this earlier that diet does affect hormones, and it's important to keep every part of your body healthy and reduced in inflammation. So we recommend a low glycemic or low sugar diet, and exercising regularly as the best way to maintain a normal weight, mood, and energy while helping the body to produce and stabilize hormones. You actually do make more hormones when you exercise regularly. Now, we also promote medical foods to help improve health and wellness. Often, our patients, when they're new with us, we have them do the Ultra Clear Plus or Ultra Clear Renew. Ultra Clear Renew is my favorite. It helps not only your phase 2 liver detox, but it also helps pull out some heavy metals and other chemicals. It's very easy to do. It's like a protein drink, and it just becomes part of your diet while you clean up your diet for about 21 days. We have 10-day kits that are a little bit more intense as well. So if you want to do it faster, you can do it like that, but you have to take more of the detox drink. And then for gut restoration, we have a whole program for it, but when we want to heal the gut lining, we use Glutoprotect or L-glutamine. If there's a lot of inflammation going on, Ultra Inflamex is something that we can use. This can be very helpful if the bowels are very sensitive. And then body composition management, the Ultra Meal Daily Support is very nice for that because it's got a nice amount of protein in it and good amount of fiber, and it's all of these drinks and products are glycemic balanced, so they're not going to jack your sugar way up. They're going to keep it stable throughout the day. So I mentioned these things because aging and muscle loss is very common. It's actually called sarcopenia. It's a degenerative loss of skeletal muscle and strength with aging. And it is, according to this JAMA study from 2001, the kind of the backdrop against the drama of disease, how it's played out. Because when you don't have a lot of muscle mass, it depletes your immune system as well. And it's when you're already depleted like that, you have less ability to maintain healthy organs and healthy tissues. So we want to maintain good protein intake, and the daily base kind of multivitamin and the protein drinks help with that if you're having trouble getting enough protein in your diet. Now, body composition is something that we look at. We do have a test for that. And basically, this picture is showing, yes, this person lost weight. She looks exactly the same, but over here on the left, I don't know if that's your left or right, but you can see there's more muscle mass in this side, the red there. And then on this side, she has less muscle mass. So she's lost more muscle than she's lost fat. So you can be a fat, skinny person, which is not healthy. So we want to make sure if people are losing weight that they're getting adequate protein, and then they're left with more muscle and not less muscle, and that will keep them healthier as they age. All right, well, if you can't take hormones, what do you do then? Well, we have supplements to ease the discomfort of menopause or andropause and to help build and maintain bone density along with weight-bearing exercise. There are numerous prescriptions and natural options for vaginal dryness, and diet and exercise can really help hormone levels and many of the symptoms of andropause and menopause. So don't lose hope if you're one of those people that cannot do hormones. There are other things that you can do. Here's some of the things that we use in our office. Fem Balance is for irregular menses or people that seem to be estrogen dominant. Fem Support is one of our kind of estrogen, phytoestrogens that helps with hot flashes, night sweats, etc. Estravera is a Russian rhubarb that is a phytoestrogen. Black Cohosh Plus, another phytoestrogen. Estrometab and Estrofocus I talked about earlier for metabolizing your hormones. Soy isoflavones, we don't carry these regularly, but we can get them to help hot flashes. His Synergy and Her Synergy are specifically made by Metagenics to help libido. And testosterone is something that we use to help men reduce their aromatization or turning of their testosterone into estrogen. Also, other things that help that are zinc and DIM for the guys. Also, Cataplex F and Cataplex M from Standard Process can be very helpful for male hormone support. And then we've got our bone support supplements, OsteoSupport at the lower level prevention, OsteoSupport Plus for probably middle age or over 50, or if you know that you already have osteopenia, Osteosupport Supreme, which has got like a multivitamin in it as well, but has some extra bone support in it. And then there's also separate boron, strontium, vitamin D3 and K2, and there's additional separate calciums and magnesiums that we can also use if it shows on your labs or if you need some additional support. And you can get more information on all of these if you look on our website, nhicwestmi.com/shop. And there's usually a data sheet for all of these items, or if you don't see it, you can always call our office. And that's about all I have to say tonight about hormones. I've spent quite a bit of time here, so I don't want to take more of your time. Hopefully, you've got some great information out of this. And if you do want to see us, you are welcome to call us at the Natural Health Improvement Center. If you have any comments or questions, you can write those down below and we'll answer them within the next 1 to 2 days. Or if you would like a PDF of this presentation, you can call the office and we can have that emailed to you. This presentation will be on Facebook and YouTube, so you can view it at any time. And please peruse our website for other information and to learn about what we do at our clinic doing functional holistic medicine. And if you have any other questions, feel free to call our office at 616-301-0808. And thank you very much for listening. Have a good night, and we'll talk to you again soon. Bye now.